Welcome everyone to the reality of health. Well, they're at it again. You knew it was coming. We all knew it was coming. Been hearing a lot about it recently. That would be bird flu, H5N1, avian flu. Seeing it everywhere, starting to become talked about, so we're going to talk about it as well. I'm telling you right now, it's just a fear tactic, like they always do. It's always about fear. You will do anything that they require if you're fearful. So we're going to dispel fear. But don't worry, it's going to be good. I'm going to help you center yourself so you don't have to worry about the next pandemic. All right, let's go. So in this graphic, what we have is what they say the cycle is right now. That as a human, you are getting infected from eating cattle or poultry. Well, apparently, the cattle are eating the poultry as well. So how is the virus going from the poultry to the cow? Probably because they're on the same farm. But what if there are no chickens on a farm with cattle and they're showing that they get sick? What bird gave that to them? Because as the last thing I saw, cows don't eat birds. So essentially what they're saying is because we eat birds, we're going to get sick. What? So what kind of reasoning works this? I'm being stupid because this whole thing is ridiculous. They've never, ever taken a well person and made them sick from somebody who was sick with a non-existent magical virus. And for all of you who are pro-virus and pro-vaccine, I'm sorry, but it's just not true. Anyway, let's move on. So this is the model. Back and forth. Somehow everybody's getting sick and animals are getting sick and it just keeps going on and on. So then, I'll bring you to this. Let's listen to what she says. Hope the mic picks this up.
He is urging state health officials to halt the sale of raw milk potentially contaminated with the high-path avian flu. Now, despite known risk associated with raw milk, more than 30 states permit its sale. Now, 3 dairy farm workers have contracted mild bird flu cases, raising concern. Now, Minnesota was the 11th state to report the virus in dairy cattle, prompting calls for stricter biosecurity measures. World Population Review reports the process of selling raw milk is legal in 50 states. Now, the process of making this milk available to the public differs, however, in various jurisdictions.
Okay.
The Idaho bird flu has been detected in some herds of cattle. Now the FDA wants states to discourage or stop the sale of raw milk because of potential transmission risk. Now, the agency urged states to issue more stern warnings in the areas where dairy cattle have tested positive. Raw milk can carry high levels of the virus. It is not known whether humans can get the bird flu by drinking the contaminated milk, but 3 dairy workers exposed to that milk have been infected, as well as cats on farms with those infected cows.
Wow. Isn't that interesting? And by the way, if you haven't noticed this over to the right, that was done in Michigan. The FDA made them, the state of Michigan made them destroy all of their raw milk products. Because. That's it. Because. So you see, they are coming after the food. They're coming after the dairy. They can't stand that you can buy raw dairy, which is very healthy. We'll have an episode in the future on that. It's proven to not only heal you of many conditions, but be one of maybe the top nourishing food you can eat. So of course they have to destroy it. They hate the fact that it's sold. They hate it. So we'll say, well, the cows are getting avian flu now. Last I looked, there's an avian flu bird virus thing, magical thing. But then there's a cow. I think they're different, aren't they? They might actually have different biology. All right. Thought this was a good meme. Remember, they are not killing the ducks, seagulls, eagles, or quail. It's simple to see the fraud. Yeah, they're not killing. You know, when they cull these herd of cattle or ducks or pigs, how come it's always domestic food that we eat? It's never, they don't just go into a forest or someplace where lots of birds are and just randomly start killing all those birds. Yet they're saying we're getting sick because of those birds. So you're telling me a blue jay or a cardinal just happens to carry bird flu and somehow I get sick from that? What? No, they are lying to you. This is all fear. For those of you who may have followed me, I don't follow the mainstream. This one's going to be hard hitting. Just warning you right now. So if you're still stuck in the matrix, I don't know what to tell you. All right. So in Australia, they are already locking down farms that produce poultry. See, they're just literally telling them, you're closed down. They say, like in here, for example, June 11th, 580,000 birds have been destroyed as part of a sweeping biosecurity controls. That's interesting. And as well as these other farms, they're saying, well, we found H5N1. Well, how'd they find it? Through a PCR test. But they say we found it, and therefore we're going to destroy everything that you've created. All of it. Did you test every bird? That's interesting. Did you find out if the birds got poisoned with anything? If at all they had anything wrong with them? And I'm going to show you that coming up. How could they possibly with as many vaccines that they get? So here we go. Australia locks down farms as avian influenza spreads. I just kind of looked at that one earlier, but the point is you're seeing in Australia, they're already shutting everything down. Now in America, they're just burning places. They're just randomly catching on fire and all kinds of nonsense. All right. Check this out. You ready? Here we go.
Current outbreak, for want of a better word, in America amongst cows is really concerning as well, and also talks to this issue of transmission. We have to understand in those cow settings, sheds, how H5N1 is transmitting, because it may be evolving into transmitting in different ways. Do the milking structures of cows create aerosols? Is it the environment which they're living in? Is it the transport system that is spreading this around the country? So this is a huge concern, and I think we have to watch, more than watch. We have to make sure that if H5N1 did come across to humans with human transmission, that we were in a position to immediately respond with access equitably to vaccines, therapeutics, and diagnostics.
So, you heard it from this guy, Dr. Jeremy Farrar, respected WHO, the whole thing. All of that is a lie. All of that has never been proven. And viruses don't learn. They are debris from dead tissue. That's it. They don't learn anything. They don't evolve. They've never proven that any viruses ever have existed ever. They've never isolated one, and virologists will tell you that. It's insane. This is fear. They're now saying that your food is contaminated. Why do you want it? They're doing it on purpose. I'm sorry, but that's the fact. It's very interesting that during the last pandemic, which was apparently so deadly that nobody died from it, they didn't die from COVID. They died from the treatments for COVID. and other things. It wasn't COVID because viruses don't exist. Period. End of story. And I'm sorry, but that's just the fact. So then they came up with a vaccine. Isn't it interesting? Huh. Amazing. Look at this. 11,000 politicians and elites received an exemption for the COVID vaccination. An exemption? Why is that? FOIA requests revealed that 11,000 politicians and members of the elite had been exempt from vaccination. And that's in the New Zealand Loyal Party, but it also happened in many governments. It happened in the U.S. Why would they need an exemption? They're the ones telling you to take it. See all the fear? Well, they're not taking it. Therefore, I'm not taking it. Then now we have more fear-mongering. Here is the International Bird Flu Summit. This is planned, people. This has been planned for a while. I'm going to show you something you're going to like in a second. But, well, you know what? I'll do that right now. What is that? Conference. October. That's 24. October 24. Well, here's event 201 before COVID. And when was that done? Oh, that's right. October of 19. Before COVID started. What are they doing now? October before bird flu pandemic, which they're all talking about right now. Watch this. Here we have the Bird Flu Summit. This is the brochure for those that are listening. It says right off the bat, in birds, in cattle, in pets, and in people. Notice they always have to put a symbol. You know what that symbol is? For those of you who know what that is, that's the Washington Monument. For those in the know, they know what that means. Oh, look, we have cows in pasture with geese. Oh, just hanging out, doing what they do, which is eating grass. That's what cows do. They don't eat feed or supplemental feed. This is what they want. Okay. I read this entire thing word for word, and I could go through all of this. But the main points here, this is interesting. I highly recommend you look at this, go and find it. But they talk a lot about these antivirals, a lot about vaccination, a lot about protecting the frontline workers. It's all about these injections, and then we get to things like law enforcement. So this is it's a summit. So they talk about stuff and how to figure it out and what you should do and learn from it. Here we have under session 5, implementing isolation measures in correctional facilities. Okay, so that would be in prisons. That happened in COVID. And if you remember what happened then, that was a complete catastrophe. But wait a minute. First responders for the fire department, session 6, enforcing quarantine measures effectively. Quarantine? Why? And where is the quarantine? Is it in my home or someplace else? And why is the fire department the one in charge of that? Oh, if you read this, I'm telling you, you would be like, wait a second. So then they have these pictures again, which kind of, I think, get worse as you go. So now they're showing eggs in egg crates. They get more into vaccine strategies and therapeutic options and, oh, what's that? Respiratory support devices. You mean the stuff that you know what happened in hospitals with people with you know what? It gets better, or it gets worse. They're talking about everything from your workplace and people staying home and supply chain issues and all this stuff. Then they get into on how to counter mis and disinformation, fact-checking and debunking. So this is part of their whole strategy. They know this is going to happen. You need to read this. I mean, it's just, I don't even know what to say. I read this and who should attend? Public health officials, veterinarians and animal health professionals, epidemiologists and infectious disease specialists, veterinarians and animal health professionals, policymakers and government representatives, pharmaceutical industry, professionals, academics, researchers, and scientists, industry stakeholders in the poultry production, livestock, diagnostics, food safety, and healthcare, non-government organizations. Why do they need to get involved? And international organizations and agencies. So my question is, I don't see homeopathic physician, nutritionist, or natural doctor. I don't see anybody outside the pharmaceutical and modern medicine and fake epidemiologists, infective disease specialists. That's all I see. All this fake, magical nonsense that doesn't exist. And they're the ones that are going to tell you how to conduct your life again. So then the picture changes, and what do we have here? Do they think that that is a beautiful picture to put in their brochure? All that says to me is, wow, I wouldn't want to be in with that many humans stuck in a barn. All those chickens just packed in there? And you think that they might get sick? That's not how any animal or person lives. Of course they're going to get sick. I got to calm down. I mean, I want to read so much to you, but this is going to take forever. So just want to keep going. There's a lot. You need to read it. But the biggest things I saw was how they're going to quarantine you. Then we get to, oh, look at that photo. We have a cow. And they're pouring milk out in the open. Like, they don't do that. That's not how they do it unless you buy it from a real farm that's doing pastured milk. Otherwise, that's not how it happens. But they want you to think, oh, look, beautiful photo. They know that's not how it's done. And when you do factory industrial farming of cattle for dairy, you're going to get weird stuff in the milk. Of course you will. You feed them garbage. There's going to be garbage in the milk. Same with you. If you live on fast food, what do you think you're going to be like? Okay. I'm moving on. And then here we have, again, another photo showing dead birds. This has nothing to do with a pandemic at all whatsoever. They're in protective gear because they don't want to have bacteria, that's the terrain of the animal, breaking it down. This has nothing to do with an avian flu virus. That is one dead bird amongst a whole bunch of other living birds. That's a live photo. Again, more stuff on everything that I would love for you to read, but then, here we have it. The infamous photo of a vaccine being injected into someone's arm. This is the whole point of the summit. And if you think I'm wrong, why is that there? That's amazing. Wow. Of course, Event 201. But you want to know why poultry as a whole, this could be chickens or turkey or duck or anything else. This is why. Factory farming. They're stuck together. Look at these photos. I know you don't want to look at them. But when you eat food outside of your control, where you know where it's coming from, this is where it's coming from. All your restaurants, all your fast food comes from here. This is not healthy. This pisses me off. This is disgusting. And then we wonder why chicken's not good for you. I talked about amyloids. This is why. They're under stress. They're in diseased conditions. Diseased as in poisons. Bacteria is not a disease. The bacteria is there to clean up the problem. This is disgusting. No wonder no one wants to eat it. And by the way, it doesn't taste very good. What's the alternative? Oh, here we have pastured poultry. Beautiful, right? You see all the wonderful hens out there just hanging out in the green, in the fields, in the pasture. They're not cramped in there. They're free to do what they need to do, eating bugs and worms, and that's disgusting, but yeah, that's what they eat. And they eat seeds and whatever else they find. Fine. Fantastic. Wonderful, right? So then why would you want to eat that? Don't eat that. I'm getting passionate now. I'm sorry. But they're scaring you to think that avian flu is out to get you the same way that COVID did. It's wrong. It doesn't exist. It's all scare tactics. All of it. All vaccines. All viruses. All disease. Chronic illness. It's all scare tactics. They don't want to cure you. That photo, that first one right there, that's not how chickens get sick. This first photo is how chickens get sick. Ridiculous. So then what we do is we give them a vaccination schedule. Oh, that sounds fun. So here's a list of the beef cattle vaccination chart. Yeah. So those of you listening, that's okay. We got 3, 6, 9, 12, 15, 18, 21. Let's call it, because a couple of these are not actual vaccines. Call it 20. 20 vaccines all set up to give to beef. Why? If they're in the field, they don't need this. If they're grazing grass and grass-fed, they don't need all this. And by the way, those places that do that, yeah, they don't give them these things. You need these because of factory farming. You don't need these in the natural environment. So look at this. Here's Merck. They're the biggest makers for, as far as I know, vaccinations for animals. Oh, what a pretty picture. You got the little chicks, the poultry chicks. Well, check this out. Watch the scrolling of how many vaccinations there are for these animals. Ready? Here we go. And I'm going to go a little fast because of time, but look at all of that. Yep. When you eat your chicken, you're eating that too. All of it. Not all at one time, obviously, but many, many of those. They have set times to give those vaccinations throughout their entire life, only because they're stuck in these barns right here, all of them. Do you see any chicken, hens running around outside? Nope. They're all inside here. And guess what? Look at no windows, no air ventilation, and this is normal. Totally normal. The vaccines have to be used because the product is terrible. They're not having avian flu because some random migrating bird came by and somehow hung out with your hen and then got the hen sick, and then the hen got your cow sick, and then you ate the cow and you got sick. That's not how it happens. It's ridiculous, but that's what they're telling you. Right there. In the very first, they're saying this happens. It doesn't happen that way. So then you think, well, it's only for feed animals, isn't it? Nope. It's for your dog too. Look at the schedule for your dog. And you wonder, why does my dog have cancer, diabetes, heart problems, joint issues? Those are the main ones, obviously, but they get all kinds of things. And then they have something called distemper. Ooh, maybe it's because of all this other stuff. And maybe they get hepatitis because of all this other stuff. What's in the base of all this? Poison. They're poisoning your dog to make money, the same way they're making money off the cattle and the poultry industry. Think about how many doses that is. So you have the human money, But then if you add it to feed animals, you got a lot more money. I mean, a lot. Well, then let's say 5 out of 10 people have dogs and cats. I don't know what the number it is, but let's say it's 5 out of 10. That's a lot more vaccinations, isn't it? A lot more money. Brought to you by Merck. YouTube's probably going to censor this one. So then if you wonder why, they've already produced all of the, not all, but a lot of the vaccine. See? All right. At the Department of U.S. Health and Human Services, said officials are moving forward with a plan to produce 4.8 million doses of avian flu vaccine for pandemic preparedness. Okay, that's interesting because right here it says, should I get vaccinated against H5N1? For now, you can't, since all of the doses are contained in the national stockpile and have not been released. Why? Why not just have them available? Because you've already said a few people got sick. The CDC is monitoring the current outbreak in cattle and other mammals. Other mammals, like who? Like what? As well as checking for H5N1 in wastewater to spot any signs that the virus is moving into people. What? So now you're saying the virus sits in wastewater, and then who's drinking wastewater? It's ridiculous. But notice the date. Well, that's 6/27/24. But they said they already have them here available. Or they said they're making them on May of 22, but then in Time Magazine says, no, they're already made and they're in stockpile. That's after they said they're going to make. So you're telling me from May to June, they made 4.8 million doses in less than a month? That's interesting. But why would they make all these? Oh, goes back to that. The summit. They know it's coming. They're planning it. Hang on. So how, Eric, do they test for the avian flu? These animals or you? Well, that would be the PCR test. And if you follow me, episode 94, the truth about PCR tests. This is my website, by the way. They are fake. 100%. You can make that PCR test show anything you want, and they know it. You just keep amplifying the cycles until it shows. Oh, there it is. Look at that. I knew we would find it. I knew it. Well, of course. So listen to that episode, and then you will understand what a PCR test is, what it does, what it's meant for, all that kind of thing. I don't have time right now. We're getting long. They're going to use the PCR test to tell you that you have bird influenza. You ever seen a chicken get a cold? It's ridiculous. Where did they even come up with this? Well, they sequenced it in a computer. You see? Scientists put the sample into a sequencing machine. The machine reads signals that tell them the order of bases or letters in the DNA or RNA. Interesting. So they use computer models to figure this out. So it's in a computer model. So it's not real. Right? Yeah. DNA is not what you've been told. And RNA definitely isn't what you've been told. They can't sequence anything. They never have. They never will. It doesn't exist the way they tell you. You can't sequence genetic code from something that doesn't exist. The virus doesn't exist as a pathogen. It is nothing more than debris from tissue breakdown. There is no genetic component. It's ridiculous. Moving on. The whole point of this episode was to tell you that, yes, they're promoting this whole bird flu pandemic, and it's a problem. And they could shut down the world, which they're planning to do. That's what the summit is telling you about. They're planning on it. Powers that be are talking about it. The news is talking about it. Everybody's starting to talk about it. It's starting to gain serious traction. Guess what? Do not be in fear. Do not give in to their plandemic. Another one. They want it. They gain control through it. They get you vaccinated, which is bad for your health. I didn't get into COVID vaccination deaths. I don't want to do that episode, but we all know what's really happening. Don't be in fear. This is how you need to live your life. When you know the truth, this is how you wake up every day knowing, I don't have to worry about bird flu. It doesn't exist and it doesn't enter humans. Never will. How can something that doesn't exist affect you? It won't. So don't live in fear. Don't live in fear any longer. Move on. Enjoy your life. Don't wear the mask. Don't quarantine. Don't give in to what they're going to force you into, because they're going to try their best. They're using the fire department. They're going to use the military. They're using the police. This one, they're either going to push harder than the last because people are awake. They knew what happened last time. They might push harder. Or they're going to be a soft situation maybe. They're just going to kind of throw it out there, test the waters a little bit. Doubt it. I think it's coming hard. Why would they do a summit the same way they did Event 201 in October before the outbreak? They're planning it. The political atmosphere right now is incredible. We all know that. In many different areas. They could actually use this as just one more layer to finally, well, thank you for listening. Do not fear. Don't fear something that doesn't exist. Be healthy. Whatever the sickness will be, because they're probably going to create that sickness. Whatever it's going to be, the healthier you are, the less you have to worry about. Take care of yourself. Thank you for listening.